Gestational diabetes is high blood sugar during pregnancy. Eating healthy, well-balanced foods and getting exercise can usually keep it well managed.
Sometimes, insulin is necessary to help manage blood sugar levels. If left untreated, it can cause health problems for both you and the fetus. Gestational diabetes is a type of diabetes that develops exclusively in pregnancy. It occurs when blood sugar levels get too high, a condition called health of both mother and baby.
It happens when the hormones from the placenta block your ability to use or make insulin. Insulin helps your body maintain the right amount of glucose in your blood. Too much glucose to pregnancy complications. Gestational diabetes usually appears during the middle of pregnancy, between 24 and 28 weeks. Your pregnancy care provider will order a blood test to check for gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy when blood sugar levels get too high. It happens when hormones from the placenta block the body's ability to use insulin. Developing gestational diabetes doesn't mean you already had diabetes before you got pregnant. It occurs because of pregnancy. With type 1, I must control my blood sugar with insulin. With type 2, I focus on diet and exercise to manage my levels. Pregnancy adds separate challenges for both of us. Gestational diabetes is well understood, and healthcare providers can help you manage it with small lifestyle and dietary changes. Most people don't experience serious complications and deliver healthy babies.
If you have gestational diabetes, you'll meet with a nutritionist.
Oh, I see. What will they do?
They'll help you manage it with a personalized plan. We'll work together to keep you and baby healthy.
So, what's the plan for managing my diabetes?
We'll have more frequent visits to monitor you and the baby.
And we will review your blood sugar logs and diet. How will we check the baby's growth? With ultrasounds and measurements. What causes gestational diabetes? It's from hormonal changes and how your body processes food. Insulin breaks down glucose can block insulin, causing high blood sugar.
A hormone called insulin breaks down the glucose from food. It delivers the glucose to your cells. Insulin keeps the level of glucose in your blood at a healthy level. But if insulin doesn't work right or you don't have enough of it, sugar builds up in your blood and leads to diabetes.
During pregnancy, hormones from the placenta can interfere with the way insulin works. It may not regulate your blood sugar levels like it's supposed to, which can lead to gestational diabetes.
Who is at risk for gestational diabetes? Anyone can get gestational diabetes during pregnancy, but certain factors can increase your risk: high blood pressure and having obesity or overweight before pregnancy. Risk factors for gestational diabetes include a personal history of it in previous pregnancies, a family history of type 2 diabetes, advanced maternal age, and prediabetes, which is a history of higher than normal blood glucose.
There are usually no obvious warning signs of gestational diabetes. Symptoms are mild and often go unnoticed until your pregnancy care provider tests you. This is why testing is so important.
Frequent urination.
Excessive thirst.
Tiredness.
No.
What are complications of unmanaged gestational diabetes? For the fetus, large birth weight and cesarean birth. Control your blood sugar to protect both of you.
Gestational diabetes increases your risk of C-section if the fetus gets too big, preeclampsia, high blood pressure during pregnancy, and a slightly higher risk of type 2 diabetes later in life.
How does gestational diabetes affect my baby?
Your baby is at risk for increased birth weight, breathing problems, also hypoglycemia, which can cause seizures, and type 2 diabetes later on.
Your provider will test your blood sugar during pregnancy
How is it done?
with a blood test. The first one is a screening.
What does screening mean?
It identifies people more likely to have it. This is a glucose screening test. First, you drink a sweet liquid.
Okay, all done.
Then, you wait 1 hour in the waiting room. After, a provider draws a blood sample from your arm. Yes, if it's high, we'll order another test. This test is only done if your challenge test results are irregular. Your fast care provider draws your blood before. The tolerance test can confirm a diagnosis of gestational diabetes. If you have gestational diabetes, you'll need more frequent checkups.
What will those checkups involve?
We'll monitor your blood sugar and your baby's health.
I see. Thank you.
We'll monitor the growth with extra ultrasounds to check the fetus isn't getting too large.
Okay, and my blood sugar?
Review your ranges daily. The ultrasound shows healthy growth.
Good. I'll keep checking my log.
You typically record your glucose levels right when you wake up, and then about 1 hour after each meal. This helps you keep track of your blood sugar levels.
What shouldn't you eat with gestational diabetes? You can help manage it by eating nutritious foods, avoid flat foods and sugary drinks. Try whole fruits, vegetables, lean proteins, and water.
Choose a healthy balance of proteins, carbohydrates, fiber, and fat for each meal. Eat smaller meals more often. Schedule your meals at the same diet can help maintain normal blood sugar levels.
Some find that small tweaks to their diet are enough, but others need to make bigger changes. What works for one person might not work for you. Everyone is different and unique.
Does drinking water lower blood sugar with gestational diabetes? Hydration is important during pregnancy, especially with gestational diabetes. But drinking water alone helps the body directly lower blood sugar by diluting the blood.
How can you reverse gestational diabetes while pregnant?
You can't reverse gestational diabetes once you have it. Your provider will test you for diabetes after your baby is born. But about 50% of people with gestational diabetes develop type 2 diabetes later in life. Eating the right foods for your body and getting physical activity can help lower your risk.
Does having gestational diabetes make a pregnancy high risk? Yes, having gestational diabetes make your pregnancy high risk when either you or the fetus has health conditions. Will my baby be healthy if I have gestational diabetes?
Yes, most babies are born healthy. There are steps to manage gestational diabetes and give your child the best start.
Attending all your prenatal appointments is very important.
And managing my diabetes the best I can. These are the 2 best things I can do.
How can gestational diabetes be prevented? It's not entirely preventable, but you can take steps to reduce your risk. Eating balanced meals and getting regular exercise are the best ways to reduce your risk. Can you eat healthy and still get gestational diabetes?
Yes, you can get gestational diabetes even if you ate healthy before or during pregnancy.
There are several other factors that go into your risk of getting diabetes. Things like hormones and genetics play a major role, and those factors are beyond your control. But if you have gestational diabetes, eating healthy, nutritious foods is one of the best ways to manage the condition throughout your pregnancy.